New hope in fighting one of the worst complications of diabetes.
Doctors may have figured out how to treat a nerve problem that can lead to amputation. CBS News' Dr. Max Gomez here with today's developments for us. Hi, Doc.
Hey, Christine. You know, doctors have long known that magnetic fields can affect everything from pain to bone healing and even depression. And now magnets may also work to treat a painful nerve problem that diabetics suffer called neuropathy. And they may even help grow and regenerate nerves. These days, Joan de Blasi gets around pretty well, but that wasn't the case just a few short months ago.
I was walking with a cane with difficulty and still couldn't tap my feet or feel significant sensation in my feet.
The problem is that Joan is a diabetic, and her high blood sugar had damaged the nerve fibers in her feet, which caused both numbness and pain.
My original pain was a pain in my left thigh, and then it spread to my feet, and it became very difficult for me to walk on this left leg.
But then de Blasi saw Dr. Michael Weintraub, who was experimenting with this device. Its spinning magnets produce a pulsed electromagnetic field that stimulated her feet. The results were just published in a study of diabetics who suffered from painful neuropathy. Some patients reported that their pain got better, although overall it wasn't quite statistically significant.
They had reduced pain in those groups. We also found that we selectively influenced burning and itching pain as opposed to routine pain.
But perhaps even more important is that biopsies of the skin of the feet show that the group treated with magnetism actually regrew some of the nerve fibers they had lost due to neuropathy.
So it opens up a whole new idea that we might be able to help regeneration of damaged nerves in the spinal cord. And there's a lot of possibilities here, Max.
De Blasi was in the magnet group, and she's convinced it helped her.
Now I can walk without a cane, and I can tap my feet, both of them.
Now, the present study only used a magnet device for 2 hours a day for 3 months, and the trend was better the longer it was used. So the hope is that continued use will help more diabetics with their pain. And there's really no downside to using the magnets, no real side effects.
Doctors must be really excited about these nerve fibers regrowing. Tell us more about that.
In some ways, that may actually be the bigger result here, because the group that used the magnets regrew nerve fibers, while the control group continued to lose fibers in their skin, in the skin of their feet, and they were the fibers that are involved exactly with the kind of burning and itching pain that's common with neuropathy. Plus other diseases than diabetes, like lupus or Lyme disease, can also cause neuropathy. But growing those nerve fibers with magnets may be useful even in regrowing nerves in spinal cord injuries, or when you have amputations and there's reattachment of limbs, for example, and you need to regrow nerves into the areas that have been affected. If you can use electromagnets to help stimulate that nerve growth, might be a big deal.
A lot of possibilities. Dr. Max, thank you.